The government backtracks its previous decision on lifting community quarantine measures. Now it says that it places all parts of the country under community quarantine due to the coronavirus disease pandemic. The Philippine National Police will issue a list of residents who will be the only ones permitted outside residence amid the community quarantines. The Department of Health says it is doing everything to correct errors in data on the COVID-19 case tracker. Latin America faces two epidemics at once. And colorful footprints guide commuters on Medellin metro cars where to stand when taking a ride.
The government backtracks its previous decision on lifting community quarantine measures. Now it says that it places all parts of the country under community quarantine due to the coronavirus disease pandemic. According to Interior Secretary Eduardo Año, this decision comes after several local government officials appealed to the national government for the community quarantine to remain in their localities. This is due to fears of further transmission of the killer virus when restrictions are eased up. So what the national government is saying is that starting May 16, low-risk areas, which are composed of 8 regions, 37 provinces, 11 cities, including the Bangsamoro Autonomous Region or BARMM, will be placed under Modified General Community Quarantine or MECQ. Let's listen to SILG Eduardo Año's statement.
Wala na po tayong area sa buong Pilipinas na hindi under ng community quarantine. Iba-iba lang pong level. Ito pong low risk ay mapupunta sa modified community quarantine.
Meanwhile, according to Malacanang, before transitioning to the new normal, all parts of the country will undergo various levels of community quarantine to continue our fight against COVID-19. These levels are enhanced community quarantine, modified enhanced community quarantine, general community quarantine, and modified general community quarantine. The Interagency Task Force against COVID-19 is expected to release the guidelines in MECQ areas sooner. In connection with that news, the national government enumerates the industries allowed to conduct its partial operations with 50% workforce in modified enhanced community quarantine areas or MECQ. These include some manufacturing industries, essential public and private construction projects, other financial services, and many more. Malls and commercial centers will also be operating partially, as well as non-leisure establishments. Rosalie Cots has more details why.
The National Task Force Against COVID-19 explains that businesses in various industries allowed to operate are only those within the non-critical or containment zones.
Maganda po nag-uusap ang business at saka po yung LGU para pagtulungan po nila. It will become their motivation. Pagka nag-open up po yung ating tinatawag na critical zone ay malinis po natin. Kung nandun po ang economic area, ay pwede pong yun ang magiging motivation po nila.
The government also stresses no public transport units are allowed to operate in MECQ areas. As for how workers can commute to their workplaces, companies are tasked to provide shuttle services for their own employees. People who are allowed to go to return to work should carry with them and present an ID and certification of employment, which will be checked at quarantine checkpoints. Residents in MECQ areas are now allowed to do outdoor exercises but still limited.
Sa modified ECQ, pwede pong limited outdoor exercise allowed. Kasama po ng outdoor walk, yung paglalakad, jogging, pagtakbo, bisikleta, highly restricted. Ang pinakamarami pong pwedeng magpulong, 5 lamang.
Gatherings even with a maximum of 5 people is highly restricted. Minimum health standards such as wearing of mask and social distancing should also be observed. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Expect to still encounter checkpoints on various roads the entire month. If you are a motorist and a person allowed outside your residence, always carry with you the necessary documents to pass through these checkpoints. According to the PNP, police personnel will continue to man checkpoints in MECQ and GCQ areas, but those will be random and staggered. Our correspondent Leah Ilagan monitored the statements of Joint Task Force COVID Shield Commander, Police Lieutenant General Guillermo Eleazar. Leah has more details, so tell us why.
In the program Get It Straight with Danielle Razon today, Joint Task Force CV Shield Commander, Police Lieutenant General Guillermo Eleazar said that they expect to face a huge challenge in ensuring that the health protocols will be implemented in MECQ and GCQ areas starting May 16.
Hindi na siguro pwede nating ma-check lahat nun. Otherwise, we will defeat the purpose of partially reopening the economy kung tutukod naman yung traffic dyan. Kaya nga, it will be staggered or random. Magche-check tayo, pag mahaba ng pila, release.
He added they will also issue a new list of persons authorized outside of residence.
There are two categories ng ating mga authorized na pwede lumabas. Based on the permitted establishments, dalawa po yan. Una, the workforce nitong mga establishmento na permitted. Pangalawa, ito po mag-a-avail ng mga goods and services.
Eleazar clarified that authorities will continue to honor rapid buses and IATF IDs at checkpoints. As for establishments allowed to reopen, such as malls and shopping centers, JTF CV Shield Commander Eleazar said they will deploy personnel to ensure that health protocols are observed.
Additional intervention gagawin natin is police visibility sa mga establishmento na permitted to operate. To check on the social distancing, wearing a facial mask, at the same time, to check kung authorized ba sila na andun so that we can caution them.
The implementation of curfew has also been beneficial, based on observation of authorities, so residents may expect curfew to continue in GCQ and MECQ areas. The JTF CV Shield also appeals to local government units to retain the curfew hours. Leah Ilagan, UNTV News and Rescue. We serve the people, we give glory to God.
Elsewhere in Calabarzon, the Department of Health Region 4A will meet the governors of Laguna, Rizal, and Cavite to urge them to place their provinces under modified enhanced community quarantine. This move comes after the Interagency Task Force Against COVID-19 came up with its decision to downgrade the community quarantine in Rizal and Cavite to general community quarantine starting May 16. DOH Regional Director Dr. Eduardo Hanairo explains that relaxed measures will result in more movement of the people, which could lead to bigger problems, especially that these provinces are neighbors of Metro Manila. If residents were to be asked about the GCQ, they have varying opinions. Some agree to extend the community quarantine for their safety, while others worry about their budget. Nevertheless, the meeting between the governors and the DOH have yet to be scheduled. Meanwhile, Davao City prepares for possible general community quarantine from May 31st. According to Mayor Sara Duterte Carpio, the city government has submitted its report to the IATF against COVID-19, which will be used in its assessment. The report includes Davao City's measures done to curb the further transmission of COVID-19 in the city. The IATF's decision will be revealed tomorrow. Based on the updates from the DOH Region 11 as of May 12, there are 161 known cases of positive cases in the city. That number includes 56 active cases, 81 recoveries, and 23 deaths. Residents in some parts of Quezon City woke up to what the government calls special concern lockdown. but Quezon City authorities explain not the entire barangays will be placed under a complete lockdown. The city health department initially selected those areas based on the results of community-based testing. Joanne Nano tells us why.
The Quezon City government has assessed that areas to be placed under what they call Special Concern Lockdown are Sitio Militar in Barangay Bahay Toro, Vargas Compound, Adelpha Metro Heights, Abanay, and Ancop, Canada in Barangay Culiat, Lower Gulod in Barangay Sauyo, and 318 Taquila Street, 2nd Alley, Kalayaan B, and Masbate Street in Barangay Batasan Hills, even Victory Avenue, ROTC Hunters, BMA Avenue, and Agno Street in Barangay Tatalon.
Bilang naman ng mga pamilya na nandun po at yung mga quarantine pass nila ay hindi na rin po pwedeng gamitin for 14 days. No? Talagang fully strict po yung ECQ natin doon.
The role of the barangay is only to help the city government to provide the necessities ng mga tao, especially foods.
Authorities will conduct an intensified COVID-19 mass testing during the lockdown period. The city government assures residents will be provided with food and other assistance. Based on QCLGU's record as of May 12, there are 1,597 known positive COVID-19 cases in the city, with 358 recoveries and a death toll of 140. The special concern lockdown will end on May 26. Joanaro, UNTV News and Rescue. We serve the people, we give glory to God.
And now let's take a closer look at the updated tally of the coronavirus cases around the world. The COVID-19 pandemic has now reached a total of more than 4,262,000 confirmed cases in 187 countries, regions, and sovereignties. The fast-spreading disease has claimed nearly 292,000 lives, while almost 1.5 million patients across the globe have recovered from the coronavirus infection. The United States of America remains to have the most confirmed cases in the world, with a total of more than 1.3 million cases, including over 82,000 deaths. The number of cases in Russia, on the other hand, has reached the 232,000 mark, including 43,512 known recoveries. Now, cases in India have begun to mount, being the Asian country outside China to have the most number of COVID-19 positives at 74,480 known cases. Meanwhile, the Philippines Department of Health, or DOH, reported today that as of 4 p.m., 268 new cases have been recorded, bringing the total confirmed cases in the country to 11,618. We have lost 21 more patients. Now the country's death toll stands at 772. But with the help of our valiant medical frontliners, 145 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 2,251. Now, let's take a look at the situation on the roads with Harleen Delgado, who is now on board the UNTV radio mobile booth. Harleen, good evening. What have you got for us this evening?
Good evening, William, Diego. Right now, we are here in EDSA Bagong Barrio in Caloocan City. And as we can see outside, we can still see some cars and even motorcycles and bicycles traversing the major thoroughfare of Metro Manila. And William, Diego, we just left Barangay 156 in Bagong Barrio, Caloocan City, which has been placed under a 3-day total lockdown. And there, William, Diego, members of the Police Community Precinct 7 of the community of the Caloocan City Police Station are manning the checkpoint because all residents are not allowed to go out of their houses. Only essential workers and persons authorized outside the residences are allowed to enter and leave the barangay. In Diego, William, the lockdown is because of the growing number of confirmed COVID-19 cases in the area. According to the barangay, as of May 13, 25 of its residents tested positive for the coronavirus disease. 10 of them are in a quarantine facility. 13 have recovered and were able to return to their homes, while 2 have died. Despite the prevailing lockdown, 2 residents were apprehended in the morning and caught by the police outside their homes. The city government of Caloocan says they have informed residents about the lockdown and have given them enough time to prepare. Barangay Chairman Maritas Go says the violators were also freed on the same day after they were issued violator receipt and a waiver. They were also given a lecture about COVID-19. She adds a financial aid were already given to each family even before the start of the lockdown, while relief operations continue for every household. Earlier, I met the barangay chairman who talked about the provisions for residents. Let's listen to Ms. Go.
Yung iba po namin na mga necessities ay wala po sa barangay namin. Kaya po ang city, kaya nagpadala po pati yung medical team nila. So kasama na rin po yung mga gamot.
While on total lockdown, swab testing has also been done in front of the barangay hall. Those who are tested include 13 individuals who were close contacts of positive cases in Barangay 156. The tested individuals were advised to undergo home quarantine while waiting for their test results. The lockdown is set to end on Friday, May 15, but it may change depending on the situation and City Health Department's recommendation. As of May 12, Caloocan City has recorded 269 confirmed COVID-19 cases, 42 recoveries, and 24 deaths based on the DOH tracker.
Thank you, Harleen, for that report. Meanwhile, the University of the Philippines group of experts say they had seen what they described as alarming errors and inconsistency in the country's health department data on COVID-19 cases. The health department, led by Secretary Francisco Duque III, welcomes this feedback. It is also coordinating with the experts to improve the data errors. But this is the assurance of Secretary Duque.
We assure the public that the issues raised are less than 1%. Maliit pa sa 1% of the whole data set and does not prejudice the overall interpretation of data and decision making.
Meanwhile, Aiko Miguel delivers more details. Why?
The Department of Health appreciates the concerns raised by the UP COVID-19 pandemic response team. The DOH has already taken note of the data errors and inconsistencies noticed. The Health Department adds there are still a lot of things to be done on its epidemiological data.
Ang DOH po ay gumawa na po ng mga hakbang para po makorek itong mga tinatawag nilang data errors found in the April 24 and 25 data drops, as well as other inconsistencies communicated by private citizens through the COVID tracker at doh.gov.ph. As early as April 26, we have since caught and corrected these issues, and we are very much appreciate the UP Resilience Institute for raising their concerns. No?
The health chief also added that only 1% of the seen errors comprise the overall data set of the COVID-19 pandemic in the Philippines. But the UP COVID-19 pandemic response team insists the numbers still have an important implication on the reliability of COVID-19 data used by the national government, LGUs, stakeholders, and private sectors to base their decision for their COVID-19 response. Some of the seen errors last April 24 and 25 are 45 cases have changed sex from male to female, vice versa. 75 patients had different age information. 516 cases were listed in a different area or residence. Secretary Duque said they have corrected their date formats and residence data. The health department is rolling out a new digital epidemiological surveillance information system called COVID Kaya, developed together with the WHO country office. The system will automate several data collection processes. and is expected to minimize encoding errors. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, about 3,500 Filipinos have been returning to the Philippines from countries also hit by the COVID-19 pandemic. Until that number was reduced to 400 returning Filipinos per day last week. According to the National Task Force, or NTF, against COVID-19, it has been initially conducting rapid tests on returning Filipinos. But local government units have been complaining about cases yielding positive for COVID-19. These LGUs asked the NTF to use polymerase chain reaction or PCR testing instead. Asher Cadapan Jr. explains why.
Ang turnaround time po ng PCR ay umaabot po minsan ng 5 days. Kung sinuwab po natin ang tao, talaga maghihintay po sila. At saka nakita po natin, kung meron pong 23,000 na tao, napakahirap po niyan na iswab every day.
With this testing capacity, National Task Force Against COVID-19 Chief Implementer Secretary Carlito Galvez Jr. is asking for patience from returning Filipinos who await COVID-19 testing.
So yun lang po ang namin, yung patience ng ating OFW kasi meron tayo kasing situation na nangyari na talagang ang dami ng OFW na nandito sa Manila. At saka hindi po pwede na ora-orada po matapos po natin po lahat yun.
Based on the NTF's data, the test results of 170 out of about 5,000 returning Filipinos who had undergone testing have turned out positive for the disease. Galvez also explained that while awaiting testing and result, hotel accommodation of overseas Filipino workers will be paid for by the Overseas Workers Welfare Administration or OWA, while manning agencies will support the seafarers' accommodation. Other returning Filipinos, including students, tourists, and Filipinos stranded abroad, may choose the procedure in which they will be required to undergo strict home quarantine protocols until their test results become available. Asher Cadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Good news from our Foreign Affairs Department. Today's figures show that the total number of Filipinos abroad who have recovered from COVID-19 has gone over the 700 mark. That includes 88 new recoveries, mostly recorded in the Asia and the Pacific and Europe. On the other hand, the total number of confirmed cases among Filipinos abroad has breached the 2,300 mark, with 77 new recoveries and 8 new deaths. The total known cases among our nationals abroad as of today is 2,310. The Philippine Coast Guard personnel assisted 175 OFWs who arrived today at the Ninoy Aquino International Airport. They all came from Hong Kong. The PCG personnel guided the OFWs in processing their case investigation form and their RT-PCR testing for COVID-19, not to mention carrying their baggage from the passenger terminal to the parking area where transport await them before heading to a designated quarantine facility. This is through the Bayanihan Repatriation Program.
Another mega quarantine facility was inaugurated today. This was through the signing of Memorandum of Agreement between private sectors and the Interagency Task Force for the Management of Emerging Infectious Diseases. This is in addition to the mega quarantine facilities prepared by the government, supported by the private sector. The fully air-conditioned mega quarantine facility in Philinvest Tent can accommodate 108 beds. It will serve COVID-19 positive cases, mild and asymptomatic, from southern area of Metro Manila. Personnel from the Office of Civil Defense and the Bureau of Fire Protection will manage and operate the facility, expected to start next week. If you are a government employee, be assured that your wages will stay the same despite the work arrangement or adjustments. The government office you are working for may even shoulder your expenses for internet or cell phone load used when working from home. Joan Nano explains why.
The Civil Service Commission has released different alternative work arrangement as several government employees are set to return to work. These are the work from home scheme, 4-day compressed work week, staggered working hours, and any combination of those work arrangements. This will become effective on May 22, but several government employees are worrying over possible salary deduction. However, CSC Commissioner Attorney Irene Lizada explained in a Get It Straight with Daniel Razon interview today that salary of government employees will not be reduced despite the work schedule adjustments.
Hindi ho binabawasan yung sweldo ngayon. Yung ng mga kawani ng gobyerno, we have the salary is still the same.
CSC also explains that government workers who are senior citizens should be required to work from home. But if the nature of their work is not doable within the work from home scheme, the employer should look for jobs where the work from home scheme may apply. The CSC adds that government offices may shoulder the expenses of an employee working from home, such as internet and cell phone load, but this will only depend on the availability of the agency's fund.
Kasi depende rin ho sa availability ng funds ng ahensya na yun, sir, kung meron. May savings na rin ho yung empleyado kasi, if you come to think of it, sir, let's say, nagko-commute siya. Diba, wala na po. Hindi na siya nagko-commute. And then, kumakain siguro siya sa canteen. Hindi na siguro siya kumakain kasi libre naman yung pagkain niya sa bahay.
The CSC also clarifies that government workers who are required to physically go to work amid the COVID-19 pandemic are entitled only to hazard pay. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
The House of Representatives approves on its second reading the provisional franchise to ABS-CBN. Vincent Arboleda will tell us why. Yes, Vincent, go ahead.
Good evening, Diego. With the action to remove uncertainty to the issue on the ABS-CBN franchise, the House of Representatives unanimously approved on its second reading House Bill 6732, granting ABS-CBN a provisional franchise to operate until October 31, 2020. This afternoon, the House leadership submitted to the lower house of Congress House Bill 6732 and was referred to the Committee on Rules. Majority Floor Leader Martin Romualdez then motioned for the constitution of a committee of the whole to tackle the bill and was approved. House Speaker Alan Peter Cayetano sponsored House Bill 6732 and delivered his speech. He notes that although there are more pressing issues to tackle, like the COVID-19 related bills and kickstarting the economy, the House was forced to do the measure as NTC backtracked on its sworn statement of giving provisional franchise to ABS-CBN. The Speaker also reminded ABS-CBN that they were the ones who voluntarily shut off following the issuance of the cease and desist order by the NTC. The bill is a temporary solution to the issue to give the House ample time to hear both sides and to have an impartial hearing before making its decision on whether to grant the station a 25-year franchise or not. During the second reading, individual amendments were made, and one of those is instead of the law taking effect 15 days after publication. Once approved by the President, the law will take effect immediately upon publication to the official gazette or a newspaper of national circulation. Diego, the House of Representatives earlier adjourned after the distribution of the third reading materials for the House Bill 6732, and they are set to resume session this Monday. That's the latest live. Back to you, Diego.
Thank you, Vincent Arboleda, reporting live from the House of Representatives. It's now easy to notify health authorities about your situation if you are a TB patient, right at your fingertips. The country's Department of Health has recently released a mobile application called the ITIS, or Integrated Tuberculosis Information System Lite. This is the official app of the Philippine Department of Health or for TB or tuberculosis notification. Just follow 4 easy steps. Download the app from Google Play Store, encode our ITIS username and password, record patient information, and report patient's treatment outcome. Again, the ITIS Lite mobile application is available for Android users. Meanwhile, the DOH has partnered with 2 other telemedicine companies in the middle of the COVID-19 crisis. This is to meet the demand for medical consultation outside the National Capital Region or NCR. These telemedicine companies offer free online medical consultation to the public. There's Cloud MD, in which you can select whether you are a doctor yourself or a patient who wants to consult a medical professional. Just log on to cloudmd.com.ph. The other is See You Doc, in which you can search for doctors if you are a patient or with a patient. There's also an option to conduct an online consultation. Just go to seeyoudoc.com. According to the DOH, mobile apps are downloadable at iOS or Google Play. And we also like to remind you, the UNTV Digital Clinic is also open 24/7 to serve you, our kasangbahay.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Kath, good evening. How are you?
Good evening, William, and of course to Diego and Arlene. How are you?
Yes, Kath, I am fine. And at the moment, we know that Thailand has just so far recorded a bit over 3,000 confirmed coronavirus cases. And surprisingly, the recoveries are more than 2,700. Where does the government there attribute this outcome of COVID-19 cases, Kath?
Well, William, according to the spokesman for the Center for COVID-19 Situation Administration, Dr. Tawisil Visanuyotin, the government is strict in finding infected people and even expanded the criteria for COVID-19 tests on people, covering those with mild symptoms as well.
Oh, all right, Kath. And what else do you have for us this evening?
William, for the first time since the pandemic began here in Thailand, no new infections of the coronavirus disease were reported and no new deaths. Some netizens are skeptical of the results, but Dr. Tawisil said the country is testing 4,294 subjects per 1 million people, which he said is higher than that of some Asian countries. He also mentioned that since the beginning of the year until now, the Department of Medical Science reported testing more than 286,000 swab samples. Thailand implemented a partial lockdown since March 22nd, where 26 types of businesses were closed until further notice. The country also observes strict physical distancing measures. The government is now preparing for the second phase of easing restrictions, where a shopping mall is gearing up to reopen for a 2-day trial. And elsewhere in South Korea, health authorities said today that a new outbreak of coronavirus cases centered in Seoul City does not need to lead to a return of strict social distancing. This is as long as new infections remain below 50 per day. The Korea Centers for Disease Control and Prevention, or KCDC, reported 26 new cases as of midnight Tuesday. 21 of those tied to a cluster of infections linked to nightclubs and bars in multinational city Itaewon and neighborhood of the South Korean capital. At least 119 cases have been linked to the clubs, including some co-workers, family members, or students who came in contact with people who visited Seoul Metropolitan Government said on Wednesday. Around 20,000 people had been tested since the cluster was first revealed last week. When asked whether the club cases could lead to a return to intensive social distancing, well, Vice Health Minister Kim Gang-lip said it is unlikely as long as the number of daily cases remain below 50, and that 95% of all infections are traceable by the government system. The White House tightens epidemic prevention and control measures against COVID-19 with new cases reported among the staff. At one entrance of the White House, most security officers, except a few, were seen wearing a mask while on duty on Tuesday. Everyone to enter the White House, including the truck drivers, was wearing a mask and received temperature check before entry. The White House started to tighten the measures this week. According to a memo distributed to staffers starting from Monday, White House officials working in the West Wing should wear masks to help prevent the spread of the coronavirus. They also need to strictly maintain social distancing and comply with visitor restrictions. As the new coronavirus kills hundreds of thousands and dominates medical attention across Latin America, another deadly viral infection is quietly stalking the region. Chris Perez tells us why.
Dengue, colloquially called breakbone fever for the severe joint pain it causes, is endemic in much of Latin America. But COVID-19's arrival has pulled crucial attention and resources away from the fight against it. Doctors and officials say the Pan American Health Organization, or PAHO, expects 2020 to be marked by high rates of dengue, which can fill intensive care units and kill patients.
On dengue, there is the possibility of surpassing the historical record of 2009, which was the year of the worst epidemic that Bolivia experienced of any other disease, with 80,000 national cases, of which 61,000 cases were registered in Santa Cruz.
In Latin America, a dengue epidemic, which started in late 2018, is still being felt. Dengue infections in the Americas surged to an all-time high of 3.1 million in 2019, with over 1,500 deaths in Latin America and the Caribbean, according to the PAHO. Cases of the disease should begin to decline in the second half of the year, the organization said, but medical intervention cannot be given if patients stay home, worried about contracting the coronavirus, or if overcrowded hospitals have to turn them away.
Dengue does not decrease because the infections decreased, but it decreases because those people with fever did not go to the hospitals. Many dengue cases were camouflaged within the community.
Chris Perez, UNTV, News and Rescue. We serve the people, we give glory to God.
Germany will start to ease some of the border controls introduced to slow the spread of the coronavirus from Saturday, with the aim of having free travel in Europe from June 15. Interior Minister Horst Seehofer said today in Berlin that general border controls agreed with France. Switzerland and Austria will be lifted from May 16. Seehofer also said that Germany's neighbors France, Switzerland, and Austria agree that it would be too early to ease border controls with Italy. Germany has the fifth highest global tally behind those of the United States, Spain, Britain, and Russia. And some acts of kindness here in Thailand. Professional chefs are cooking up around 40,000 lunch boxes over a period of 10 days for local communities affected by the coronavirus pandemic here in Bangkok starting today. Chef Hugs, a local charity, hired for this project 200 chefs and dozens of taxi drivers, many of whom are currently living on very little income. Some of the chefs are from renowned restaurants across the capital. All chefs involved in the project are receiving 400 baht or $12 a day, while taxi drivers are earning 300 baht or $9 for transporting the food to 50 local income communities across Bangkok. Around 4,000 meals made and delivered each day. Meanwhile, the government is considering reopening shopping malls next week. It is expected to meet on Friday, May 15, to decide on the easing of measures. And those are the reasons behind the stories here in Thailand and the other parts of the globe. Back to you, William.
Thank you, Kaf Dumaraos, reporting live from Bangkok, Thailand.
Metro card commuters in the second-largest city can now assure physical distancing. guidelines when on public transport. Metro authorities in the capital of Antioquia province, Medellin City, enjoined graffiti artists to paint thousands of colorful footprints to guide commuters where to stand on metro cars. Nina Armilio tells the story why.
10 artists in Colombia used their design and painting skills to open a new front in the fight against the coronavirus. On medics, as of today, Colombia has reported over 12,000 COVID-19 cases and nearly 500 deaths, according to its health ministry. Nina Armilio, UNTV, News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news, May 13, 2020. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I am William Pio. We serve the people. We give glory to God.
Because we need to know, we will always ask why.